Once touted as heroes, healthcare workers say they're now getting threats. Some nurses and doctors say they have to deal with hostility as families and patients are upset about COVID policies and procedures. It's happening close to home, too, in North-Idaho.
I think it's reprehensible, and for people to be critical of them, I think it is so un-Idaho to me. It's foreign to me that people would do that.
So what can you do to stop the spread? As we navigate our way through all the information out there, it's never been more important for us to be discerning about the information we trust. Good evening, I'm Aaron Luna. Nia Wong has the night off. Emily Bloom is here with how you can avoid spreading misinformation. Emily.
Aaron, you've probably seen it in your newsfeed, COVID conspiracies and far-reaching vaccine theories that are not validated. It's that kind of information people are buying into, and it's why we're having such a tough time pulling out of the pandemic. We're looking into how we can overcome that and what role we can play in helping the situation.
So one thing that we say in our center a lot is think more, share less.
From Jevin West's perspective, we've hit a new low as healthcare providers take the hit for the unwarranted theories some people are trusting.
They're being attacked by the work. Now they're being attacked by, the individuals that are just being misinformed about this.
He says in some ways, this is why we've seen the state mandates on masks and vaccines.
There are groups that have convictions, when not just false belief in something, but convictions when it comes to, these issues right now around masks.
Conspiracy theories have always been around, but because of our access to all the information, we're living in a time that's different than any other.
These social media platforms and the algorithms that run them are designed to grab our attention, and they don't care. And I mean they being the algorithms. They only care about grabbing our attention. They don't care about the content.
Earlier this week, we saw YouTube take a stand on the anti-vax information circulating their platform.
That we have to be extra careful about sharing things that we haven't vetted ourselves, or at least do a little bit of work beyond the headline.
At a time of such uncertainty, our appetite for answers has never been so high.
We can't just treat the virus that we're dealing with right now, or any challenge that we have. We have to also treat the information that people are getting.
To vet the information that you're reading, look into where it's coming from, what the source is, and who the author is. This is one role we can play in tackling misinformation that experts say lead to the vaccine hesitancy that we're seeing so close to home. Reporting in studio, Emily Bloom.